sick from COVID-19, we all wonder who they've been in contact with and if it was you. This is also one of the health department's biggest questions. To date, they have hired 600 people to figure out how many people came into contact with each infected person. They're called contact tracers. And today, Claire Kreitz talked to a couple of them firsthand about how hard it is to follow the footsteps of Arkansans who have gotten sick.
Yeah, that's right, Bob. There are two companies working with the Department of Health to track down potential positive cases. Today, I was able to sit down with two contact tracers with the Arkansas Foundation for Medical Care Incorporated. They spend all day making calls, and it all starts with a positive case.
Hi, my name is Yolanda, and I'm calling on behalf of the Arkansas Department of Health.
Yolanda Giles spends 8 hours each day, headset on, dialing numbers.
We get a list of contacts, individuals that have been infected with COVID-19.
She starts by asking some basic questions,
Like their name, date of birth, telephone number, address.
then moves on to some more specific details.
And if they traveled, who they've been around, if they've been to local restaurants, community events.
Hola, muy buenas tardes. Mi nombre es Mahaira.
It's all done in Spanish as well.
Respiratoria causada por COVID-19.
Mahaira Gonzalez is another contact tracer and says it's crucial to have callers who can reach those who don't speak English.
Usted ha sido identificado. As soon as they hear somebody that speaks their language, they feel safe. They feel confident in telling you what's going on.
Now, once they record all of the places and people those positive cases have come into contact with, they determine who is a direct contact.
Person that you've been around for 15 minutes or longer, less than 6 feet away from.
Then there's a new list of names to call.
So we let them know about their exposure. We give them the Arkansas Department of Health recommendations, quarantine, avoid public activities, etc.
Now, both Giles and Gonzalez say getting people to pick up the phone
Most of the time they won't.
is half the battle.
You keep calling.
With each name crossed off the list, they are working to keep more from being added.
So the fact that we can let them know that they were exposed so they can be on the lookout or at least quarantine for a couple of days, that can save a lot of lives. Arkansas Department of Health, may I please speak with me?
The contact tracers say they make about 60 to 70 calls a day. A big part of it, too, is letting those positive cases and those exposed know about different resources like housing and food delivery, since they do need to quarantine. Their number is 833-283-2019. So if you do get a call from that number, they ask you to please answer it. Now, if you can't remember that, we've put it on our website. You can go to KARK.com and search Contact Tracer. Bob?